Good morning and welcome to the Windsor-Essex County Health Unit's media briefing for Thursday, May the 5th. We are joined today by our CEO, Nicole Dupuis, and our acting MOH, Dr. Shankar Nesathurai. We will open the session today with some opening statements from Nicole Dupuis and then some supplementary comments from Dr. Nesathurai.
Good morning, everyone. Our community has faced many challenges over the past 2 years. This week, May 2nd to the 8th, marks the 71st Mental Health Week in Canada. This year, the Canadian Mental Health Association's campaign reminds us of the importance of getting real about our mental health. Additionally, May 7th is recognized as Child and Youth Mental Health Day, recognizing the importance of mental health needs for children and youth in our country. Every person, every individual has experienced the COVID-19 pandemic differently. As leaders for mental health locally and nationally, CMHA, Canadian Mental Health Association, is challenging us to be courageous and to #get real with ourselves and with others about how we really feel. Getting real with our feelings starts with each one of us. It's hard to understand each other without first understanding ourselves. Sharing your feelings and being open and an active listener for others is an important part of supporting positive mental health and reducing stigma for mental health. If you are looking for more information or support for mental health, we encourage you to visit our website at wechu.org/mentalhealth/where to get help. And you can also contact us at 519-258-2146 or call 211 or visit 211 Ontario to find mental health resources near you. As well, if you are experiencing a mental health emergency locally, you can call the Community Crisis Center at 519-973-4435. And we encourage everyone to continue to talk to each other and continue to support each other now and throughout the year. Thank you.
Thank you, Nicole. Dr. Nesathurai, would you like to add any comments to that?
Yes, colleagues, thank you. Thank you for allowing us to share our thoughts on this very important item. 4,000 people, about 4,000 people committed suicide last year in the country. About 1,900 people died in car crashes. The reason I share this is that the burden of mental health is significant, and the effect of suicide, which is the most severe manifestation, or one of the most severe manifestations of mental illness, is greater than the number of people who die in car crashes. The one message I would try to emphasize to the community overall is that if you are experiencing mental health distress, get some help. It's okay to get some help. Mental illness has a spectrum. It has the people that are most severely affected with depression. And there are treatments for that. And there's some very good treatments for depression. And there are people on the more milder or less intense spectrum of disease who still need help. And during the pandemic, I think that there has been a greater burden of mental illness, be that depression, anxiety, bipolar disorder. There's been a greater burden to people in the community, and perhaps there's been a disproportionate burden to young people and children. And to that extent, that we would really encourage people to get help, because help can make a difference, and it may potentially save a life. If I could shift to some other topics as well and make some comments. These past 2.5 years, past 2 years and 3 months have been predisposed to talking about COVID. The Epidemiology Summary is available to you. Some of the metrics suggest a decline in the burden of disease. Some suggest some level of stabilization. I think at a provincial level, I would say the data suggests that we're sort of in a steadier, the disease activity is perhaps a little bit better or more about the same as it was the previous week. The last time I looked at the numbers in 2020 and 2021, I believe 9,000 people died of COVID. I think in the province during that period of time, about 900 people died in car crashes. The burden of COVID still remains significant to our society. We have to learn to live with COVID, but part of learning to live with it is to identify strategies that will help mitigate the burden of disease, recognizing that it's likely going to have increasing level of activity and decreasing level of activity. So in that context, myself, the medical officer of health for Peterborough, and the acting medical officer of health for Niagara wrote a letter to Dr. Moore. We asked him, we support his expansion of required masking in certain settings, and we asked him to broaden that to require masking in all indoor activities or indoor areas, including schools, colleges, universities, anywhere. And so we're hopeful that the province will take action moving forward. I'm happy to answer any questions, but I hope that we can get the message out collectively on the importance of mental health moving forward this week as well.
Thank you very much. We will move into our first round of questions from the media, starting with AM 800.
Doctor, just to that point, I have a quick question. Then I want to ask a question about the Epi Summary. When was that letter filed to Dr. Moore?
It was sent yesterday evening, and I think Peterborough sent a press release today.
And then you mentioned indoor settings. So would that include bars, restaurants, movie theaters, fitness centers, you name it, anything indoor?
Anywhere indoors where people, yes, I would include it broadly for indoor activities. Yes.
Okay, thank you for that. And then just looking ahead to the Epi Summary for the past week, it seems like we're turning the page here in Windsor-Essex. This is back-to-back weeks where we're seeing a decrease this past week, 36.8% in high-risk cases. Are we turning that, I guess, is it safe to say we're turning the page on the latest peak in the region?
Yeah, I think the better characterization, at least from my perspective, doctors are always cautious, right? We're always cautious, and we don't want to predict the future. I think disease activity is, looking at the metrics, is lower than it's been in previous weeks. So that being said, there are, I believe yesterday, we can give you the exact number, 48 people in the hospital, 4 people in the ICU, and 3 people who died in the past week. And provincially, the number of people in the hospital is 1,700, which is a 2% decline. But the number of people on a ventilator, and I'm just looking at my notes here, the number of people on a ventilator actually increased to 93, which is a 2% increase. So I think a better approach would be or a better assessment would be to say that we are seeing diminished disease activity, but we should be cautious in looking. Or in some cases, the metrics are stable. In some cases, there's a suggestion of decreased disease activity, but we should be cautious in our conclusions and inferences at this point.
Thank you. Sorry, going back to the letter, I know you, like you mentioned, you issued it yesterday, or it was issued yesterday. I'm guessing in the past you've fired off letters to Dr. Moore or the previous medical officer of health. How long does it usually take to get a response? Like, are you expecting something by the end of this week, or will it be next week? I guess in past, are those responses pretty quick?
We've had dialogue with provincial officials from throughout the pandemic, and there is a mechanism that we are able to speak to Dr. Moore or share our perspective with him, either directly or through other public health officials. I think that the key question is not when Dr. Moore will respond or at the timing of his response. I'm sure he will be reviewing it. It really is about the public policy choice that we have to make collectively for the province, and how do we learn to live with COVID and how do we balance the risk versus the benefits. My assessment, or our assessment, and I think the assessment of my colleagues who signed the letter, is that we think at this point in the pandemic, instituting a direction towards requiring masks indoors will further build on the policy that the province has already promulgated, and further will help mitigate disease. It won't be. It'll be one additional step to diminish the burden of COVID-19 as we move forward in the pandemic.
Thank you, sir, for those additional questions there.
You're welcome.
Any questions from CTV?
Yes, good morning. Can you explain kind of how it works? Why send a letter to Dr. Moore rather than issue an order here?
Well, I think that a policy of this nature really requires concerted provincial action. I don't think it would be as effective if it happened at a local level, perhaps at a regional level, but not at a local level or an individual health district level. As public health officials, our responsibility under the statute, is to try to advocate, articulate, and effectuate programs which we think will have an impact on the health of the community. I think at this point in the pandemic, a province-wide approach would be, or a more appropriate measure to bring about additional measures to diminish the burden of COVID-19.
Thank you. And why now? I guess some would say, why not a month ago? Why you decided to send the letter now?
Well, I think that we've been continuing to articulate this perspective for a number of weeks, where we've asked the province to act on this item. I think that looking where we are in the pandemic and our experience, I think it's still a worthwhile measure. For me, from my own perspective, I think that we have to engage in the dialogue about how we return to normalcy. And returning to normalcy includes when there's higher levels of disease activity to require masking indoors. It also requires continued social distancing. It requires continued encouragement of vaccination. It requires an acknowledgement of risk when we attend events with large numbers of people. And so, from my perspective, this is just one more part of our management of the pandemic. We do want to provide support to Dr. Moore if he elects to move forward with that policy, and I think stating it formally is one additional step to help manage the pandemic.
Thank you.
Any questions from CBC?
Yes, sorry about that. So just to be clear, in the past, you had made the perspective known that you wanted to bring back this measure, but this is the first time you formally issued a letter?
Yeah, I think the better characterization is we've shared this perspective with the province and with Dr. Moore in the past. This is just one additional step where we communicated in written communication, but we have communicated that verbally, and we've communicated that publicly. And other medical officers of health have also communicated in a similar manner towards the province, with the province and our provincial colleagues.
Thank you very much.
Any questions from Blackburn?
Yes. First, just going back to the mental health issue, I'm wondering if the public health unit keeps any statistics on local suicides.
Go ahead, Nicole.
So we do monitor, but what we have available to us from a surveillance perspective is provincial data, and it does lag a little bit. So we don't have sort of an active surveillance system necessarily for suicides. We do, as you probably know in the media, have our we co-lead the Suicide Prevention Awareness Month and coalition with the Canadian CMHA, Canadian Mental Health Association, and we do provide a refresher and update of what information we do have available, usually around that time of September for Suicide Prevention Awareness Month. But we don't have an active surveillance system where we're getting active reports, daily or weekly.
Okay.
And Dr. Ness,
No.
I don't know if
Go
Dr.
ahead.
Necessary wants to add at all.
Yeah, I don't think, obviously it's an important thing to know what the data is at a local level, but there's no reason to believe that the experience of Windsor-Essex is that much different from the rest of the province or the rest of the country. And so I would anticipate that if we were to project the data nationally, it would probably demonstrate, in general terms, the same or similar burden of disease in Windsor-Essex as opposed to as nationally. So stated another way, I think the burden of suicide, which is probably one of the more severe manifestations of mental illness in Windsor-Essex, is greater than the burden of disease associated with car crashes. And the reason I share that is when we think of all the energies that we do to prevent road traffic collisions and accidents, speed enforcement, better engineering, medical treatment, rehabilitation facilities, our public policy focus on suicide and mental health and all manifestations of mental health should remain a priority, and we should devote the time and attention to try to mitigate the burden of mental illness.
In the past, Windsor-Essex has had we've had a shortage of mental health professionals that seems to have improved. Coming into this region from another region, how would you, characterize our availability of mental health services in Windsor-Essex now?
Well, perhaps Nicole can start that, and I'll maybe add to that, or I can start. Nicole, which would you prefer?
Go ahead. You can start, and I can add.
So the first part of managing from a community-wide or population health level is to raise awareness so that people who need help or can get help. There's a spectrum of clinical services and providers that are required to effectuate a robust mental health program. That includes physicians, and specifically psychiatrists and family doctors, but it also includes non-physician clinicians like psychologists, social workers, counselors. It encompasses the fact that there's an overlap between substance use and mental illness. So that includes all substance use services, be that outpatient or inpatient. I think it's fair to say that there are gaps in timely access to mental health services. I think that there's more access for people who might be in immediate mental health crisis, and it's more challenge, and people may have more severe mental health diseases. But for people who have more chronic or subacute conditions or need more community-based services, there's still a lack, or there are gaps in access. There are gaps in access for children, and there's gaps in access for people who have substance use disorder. From my perspective, speaking as a public health official, but also as a practicing physician, this is an area where we do have to spend additional resources to improve access to services. There are opportunities perhaps to reorganize services, but really at the end of the day, I think that people who are requiring mental health services need timely access to treatment. This was a problem before the pandemic, and my sense of it is it's even more challenging subsequent to the pandemic. Nicole, maybe you could add any local context, because you know that there are resources, but I'm not as facile as you are on those.
Yeah, and we're obviously, public health focused upstream and health promotion and, certainly prevention. And we're not experts in the mental health system but I will just say, yeah, definitely there's been some improvements in investment in mental health. There are a number of resources that didn't exist previously. And so to say that there has been improvement, you're absolutely correct. There has been improvement in what is available and how that system works together and how connected our mental health system is. We have a great network of providers here who do meet regularly and continually talk about, how to improve pathways for individuals, who need assistance. But as Dr. Nessathuri rightly identified, and it's not unique to Windsor-Essex, certainly across the province, but there are still significant gaps and significant investment that's needed. And there are still extensive wait times for mental health services, and which is why there's been a local investment, certainly in we have the Youth Mental Health Hub and other services where urgent care, et cetera, for mental health, where, individuals can, get in quickly and then move on, maybe to services, later on if they're on a wait, et cetera. But there's definitely more investment that's needed. But there is concerted work happening here, for sure. And there has been improvement, I would say, from my perspective, and our mental health system locally and what's available. And for children and youth, certainly, again, things that have happened recently, such as the Youth Hub, are really a great start, I think, to improving some of the access and systems for children and youth. But we still have a long way to go.
Just switching gears, and I hope you'll be patient with me here, but I wanted to ask Dr. Nessathuri, you have mentioned that, a local approach for masking indoors may not be very effective, but a regional or a provincial approach is what you have talked a lot about. If the province doesn't want to do it regionally, is there any way that you could maybe talk to Sarnia-Lambton, Chatham-Kent, London, Middlesex, those areas, and put something in place for at least southwestern Ontario? Like, are they amenable to it?
Well, we have, as public health officials, we have continuous dialogue with our colleagues in adjacent health districts. I think at this point, it's really an item for provincial direction. There always remains every option moving forward and keeping all those options available to us. But I think at this point in the pandemic, it's provincial direction that will be required, I think, to effectuate an effective plan for this.
Thank you.
Any questions from the Windsor Star?
Hi, yes, thank you. My question is around vaccines, specifically fourth doses. So the eligibility for those is still fairly narrow. Is that something that you'd like to see opened up at this point? And is it something where we're still pushing people to get their third booster dose and their fourth booster dose if they're eligible?
Yeah, I think the key message I'd share is we want all the people who are currently eligible for their third and fourth doses to get them. I think the numbers that our epidemiologists prepared were that only about half of all people who are eligible for third doses have actually received them. The reason that's a concern is that 4 months, 5 months, 6 months after your last vaccine, you lose some of the effect of the vaccine protection. And we're having a large contingent of people who are having waning immunity as well. And so at this point in the pandemic, I would focus our energies on getting people currently eligible vaccinated. Do I anticipate that additional booster vaccinations will be recommended? I think the answer to that is yes. What the timing of that is, I'm not certain that I can comment on the exact timing of that. I think the plan to move forward and to return to some level of normalcy requires periodic, or is likely to require periodic booster vaccinations, and we'll have to have a program for that. And to make that happen, we'll need to have multiple venues of booster vaccination. That includes pharmacies, physician offices, public health service sponsored clinics, community clinics. And that's something we have to really plan for as we move forward. We also have to plan to get antiviral medicines to people who would benefit from them. And that's the other part of the plan of trying to return to some level of normalcy. I would also reach out to those people who are not currently vaccinated but are symptomatic to if they are symptomatic or they fall into other high-risk groups, including people who are not vaccinated, to see their doctor, because antiviral medicines can make a difference. But we need to get those medicines into people early, and that requires an early identification of if you're ill, and then to meet with your doctor to try to get treatment. So that, I think, would be the plan moving forward.
Thank you.
We will go to a follow-up round of questions with one question per media outlet. We will start with AM 800.
Doctor, just going back to one of my colleagues' question about why now, and then I believe you mentioned, obviously, there's been dialogue, but now the letter has been sent. Do you feel sending a letter will make a difference, even though that dialogue has been happening the past few weeks?
Well, I'm always an optimist, and there are multiple ways to communicate with your colleagues. One of them is by phone, one is by video, others are in writing. They each serve the goal of reinforcing or restating the message. I remain optimistic that we will have additional action on the part of at a provincial level. I think it's our responsibility as public health officials to contribute to the dialogue about this matter. It's probably the most consequential public health event of my lifetime, and I think that it's incumbent on us as public health officials to share our perspective and share our recommendations with our provincial colleagues.
Thank you.
Question from CTV.
Yes, just one more. Will the letter be on the health unit's website, or will we be able to get a copy of it?
It's a public document, so I don't see. I'll ask my colleague Mike maybe to perhaps circulate it. I think Peterborough has already promulgated it publicly, but if not, we can get a copy to members of the media.
Great, thank you.
Follow-up question from CBC.
I'm all good, thank you.
You. Follow-up question from Blackburn.
Nope, I'm good, thank you.
And a follow-up question from Windsor Star.
No, I'm good, thank you.
All right, thank you very much, everybody, for joining us. Again, we will meet for our next media briefing on Thursday, May the 19th. Have a wonderful day.
You too.
All the best.